And this week, the state epidemiologist attributed Utah's downward COVID trend in part to Salt Lake County's mandatory mask order. But wearing a face mask raises questions for a number of people, especially those with asthma.
Some living with the condition say wearing a mask makes it harder to breathe, but does it really? ABC4's Brittany Johnson, who has asthma herself, by the way, puts her oxygen levels to the test.
Research shows wearing a mask is one of the most effective methods people can take to help slow the spread of COVID-19. Yet, people worry wearing a mask will lower oxygen levels and make it harder to breathe.
It's extremely unlikely that it would, Brittany.
Dr. Mark Lewis is a medical oncologist and director of gastrointestinal oncology at Intermountain Healthcare. He oversees cancer treatments. Dr. Lewis says wearing a mask or face covering will not lower your oxygen levels.
The airways down here that are moving air within the lungs are getting very, very narrow. And that's when people use inhalers, what that's actually doing is opening up those airways. So the problem is not up here, okay? The problem is not at the mouth. The problem is down here. So my real point is having a mask covering your face and your mouth is not affecting airflow down in your lungs.
Dr. Lewis uploaded this video to Twitter. He used his personal box of 30 masks provided by Intermountain, put them all on at the same time after an 8-hour work shift, and says his oxygen levels didn't drop.
Yeah, I've had a history of cancer myself. I've had a blood clot in my lung. I'm not a perfectly healthy person, and I was able to do it at altitude with no drop in oxygen.
I have asthma and carry this oximeter around with me to monitor my oxygen levels. It's not medical grade, but Dr. Lewis says these oximeters that you can buy online or at your local store work just fine.
I have no reason to suspect that you would get a faulty reading.
So I put it to the test and monitored my oxygen levels for 5 minutes in each scenario. Not wearing a mask, wearing a surgical mask, a cloth mask, and an N95 mask. There was no significant change in my oxygen levels. Dr. Albert Rizzo, Chief Medical Officer for the American Lung Association, told ABC News masks have no detrimental effects, even in patients with chronic lung disease.
Remember, this is a really serious and potentially fatal illness if it gets down into your lungs. So far from it, the mask being harmful, the mask is actually protecting you during the pandemic.
Dr. Lewis does say if your respiratory issues are severe, consider a face shield instead of a mask. And if you can't wear a mask or face covering because of severe asthma or breathing distress, the Asthma Allergy Foundation of America recommends some of the following. Stay home as much as possible. Ask others to run errands or shop for you. Keep a distance from others. Avoid or limit close contact with people who are sick and wash your hands often. Clean and disinfect your home and car regularly. Reporting in Salt Lake City, I'm Brittany Johnson, ABC4 News.
Dr. Lewis points out he wasn't trying to be silly in the Twitter video. Instead, he adds, he was trying to make the point, so he went to the extreme to do so. Dr. Lewis also says your oxygen levels should be in the 90s. If it's lower, make sure to contact your doctor.